Hi everybody, this is Rachel from Wellness 360 Physical Therapist. We have Beth with us as well today. We are going to go over some neural priming exercises which will help assist you to get warmed up for our activity today. So what we're going to have Beth do, we have 4 dots on the floor. We're going to start with some heel slides. So right foot to the right, left to the left. You're going to alternate these. So you want to get that knee into full extension here. You're going to go back and forth. Alternating sides, we'll do 10 on each side. This is just to increase the blood flow to the legs. Neural priming has been found to make your way of exercising a little bit more effective. So we'll go back and forth a few times here. 10 to 20 is a good place to start. Almost there. So the next exercise, it's going to be a similar pattern, but what you're going to do now is you're going to actually pick up your feet. So you're going to go red dot to green dot and back, and you'll alternate. The reason for the dots on the floor, you can use duct tape, you can use colored tape, you can use just any sort of target. This just allows for the person doing the activity to actually have something to reach for, to allow for that full extension of the lower extremity. We'll go through a few of these. Again, 10 to 20 is a good place to start. Number 8, 2 more to go. Last one. And what we can do next, kind of to give just a little bit of a progression, is we can move these dots out to the side. This is going to allow for a little bit different of a movement for the hip. This is called hip abduction. So we'll start with just the slides. Again, make sure that that point at the end allows for that full extension of the leg. And as you see, her hip is going a little bit more out to the side, just to, again, improve the blood flow to the lower extremities to get them ready for exercise. 10 to 20, again, is a great place to start. And then the progression is going to be picking up that foot and tapping it to the dot on the outside. Okay, finish up my 10. And we're going to tap. Again, remembering the heel slide is a good warm-up phase, and this is a extension, making it a little bit more challenging. And Beth's doing a really good job pointing that toe as well as extending that knee. Almost there. We have 8 on each side. Okay. All right, our last exercise of the warm-up is going to be a sit to stand. So we're going to talk you through how to do this properly. So Beth is already in a good position. She is scooted to the front of the chair. We're going to make those legs a little bit wider to give yourself a little bit better base of support. Something you want to remember when you're doing a sit to stand is you always want your momentum going forward. So we're going to have Beth lean forward, and we're going to stand up, lift the butt from the chair. Good, stand all the way up, and then you're going to stand all the way back down. We're going to do 10 of these, and this will be the end of the warm-up for today. If you have balance difficulties, this is a great time to have a chair beside you so that you can grab a hold and have a little support. You don't want to use it to pull your body weight, but it's great to have for balance. Maybe you do it next to a countertop where you can have something sturdy to hold on to keep your balance. You can also increase the height of the chair. You can add a cushion underneath the bottom. You can also get into a chair with arms on it. Again, this is going to help improve your ability to complete the transfer. You don't want to be necessarily relying on those extra components, but they will make this a little bit easier for you. This is a great functional activity. It's something that you do all day, every day, on and off the toilet, in and out of bed, in and out of a chair. So it's something that's a nice functional task that you can incorporate to everything throughout your day. So I'd like to go over just something really quickly if you cannot get out of your chair. What we'd like for you to do is just work on coming forward, nose over knees, and just rocking that butt just an inch or two out of the chair, just to get that fluid motion of that forward motion, and the butt just an inch or two off of the chair, keeping all of the weight in the heels and rocking forward. And then as you get stronger, you can stand all the way up. So this is your neural priming workout. Thank you so much for joining Rachel and I, and we'll see you soon. Please reach out to us if you have any additional questions.